Hi, I'm Dr. Laura Nelson with the Arizona Department of Health Services, Division of Behavioral Health. During the past several years, Arizona has been confronted with perhaps the biggest financial challenge in its history. In fact, since 2008, state agencies have reduced operating expenses approximately $800 million by instituting hiring freezes, salary reductions, furloughs, and by reducing or eliminating entire programs and critical services throughout our state. Despite this bleak picture, thanks to our governor and her commitment to behavioral health, our services had been spared major cuts until this current fiscal year. Regrettably, we now find ourselves at a point where our behavioral health safety net of programs and services that serve many of our most vulnerable members must be reduced. Here are some of the numbers that help tell the story. Instead of having close to $130 million in state general fund, we now have $62 million. Instead of having $90 million to serve adults with serious mental illness, we now have $40 million. We now have slightly more than $16 million for crisis services and about $5.3 million for supported housing services. Despite facing this unprecedented challenge, I want our community to know the Division of Behavioral Health's commitment has consistently been and will continue to be to approach each and every decision in a way that maintains dignity for the people we serve, promotes recovery and self-determination, ensures high-quality care, serves as many people as possible, promotes transparency through the communication of active, real-time information, promotes collaboration, and includes peer, family member, and stakeholder participation. Our annual budget, which just began on July 1st, was approved in late March of this year. Fortunately, this allowed for some time to prepare, plan, and appropriately implement these service reductions. Back in March, when the budget became final, we immediately deployed staff into project teams. These teams, called Phase 1, began the difficult work of engaging in extensive research, financial modeling, and gathering input from stakeholders across the state. Significantly, each project team included peer and family members whose contribution was invaluable in each step of the decision-making process. Together with our regional behavioral health authorities and community providers, we were able to reach over 2,300 individuals, family members, advocates, and stakeholders through 40-plus community events. The final work product of the priority project teams, completed on May 3rd, is found in a series of detailed guidelines published on our website. During May and June, we began working to implement the guidelines, which we called Phase 2. During this phase, REBAs and community providers engaged in individualized outreach, education, and transition of non-Title 19 SMI members to the reduced benefit package. While this work was continuing, the division reconfigured our priority project teams in order to address policy and contractual revisions, develop supplemental guidance documents, evaluate REBA progress in transitioning members, establish ongoing financial and performance monitoring mechanisms, and continue to support statewide communication needs. As in Phase 1, each team had one or more peer, family member, and community representatives. Active and ongoing real-time communication has continued to be a priority. In addition to community forums and information sessions conducted statewide, we have been active on Twitter and maintain an updates website that has a number of frequently asked questions, guidance documents, community resources, and YouTube videos. While clearly this has been a difficult and challenging time for all of us, it has also been a time of creative thinking, promoting personal responsibility, empowerment, hope, and community unification. We have seen consumer, family, and advocacy organizations volunteer and unite to support each other and themselves, becoming part of the solution. I am pleased to cite several examples, many that involve peer and family-run organizations. In northern Arizona, NASCARE through funding from NARBA's Community Reinvestment Fund, continues to provide services no longer covered for non-Title 19 SMI individuals. In Maricopa County, a peer-run organization, Stand Together and Recover, has found jobs for many non-Title 19 SMI individuals by helping them become eligible for Access's Freedom to Work program. STAR is also providing services to veterans in collaboration with the Veterans Administration.
Hi, my name is Suzanne Legander, and I'm the CEO of STAR, Stand Together and Recover Centers. I wanted to talk to you today and tell you about all of the steps that we are making to try to help with the non-Title 19 changes. My organization has been actively participating with the Department of Behavioral Health Services to provide the peer perspective and the family perspective on the changes that are going on. And our voice has been actively listened to, and steps have been made with Department of Behavioral Health to take our suggestions and try to improve things for the overall system. At STAR, we have been actively involved in trying to find employment opportunities for our peers. By finding the employment opportunities, this gives our peers the ability to qualify for Freedom to Work, which gives them the ability to have additional behavioral health services. We have also been working with the Veterans Administration because at this point in time we have veterans returning from active duty, and they come back with depression or anxiety or other issues, and they are non-Title 19, and we want to make sure that we are meeting their needs. So we are a fee-for-service program through the VA, and we want to continue to provide those services to the brave men and women that have been there supporting the United States and protecting us.
Visions of Hope is offering a support group for non-Title 19 SMI members twice a month to help them find jobs and qualify for services.
Visions of Hope is a peer-run organization that is totally run by peers. At Visions of Hope, we offer non-Title 19 assistance in jobs and Freedom to Work, and we also have a warm line assisting people that have not received services due to the fact of the budget cuts. We have offered a warm line that they may call in and get assistance from us daily. At Visions, we offer non-Title 19 support in Freedom to Work, jobs. We look at the total person and the choices that they choose, and we give them the opportunity to be successful at Visions. We offer them a lunch and a fun time to work and get involved in our community at Visions.
Simpatico has committed to using community reinvestment funds for startup costs for new consumer or family-run businesses. Non-Title 19 SMI individuals are encouraged to submit proposals. CPSA is using funding reserves to help consumer-run agencies. The agencies will provide support groups, information about community resources, employment services, a warm line for non-crisis support calls, and other programs. Hope Inc. provides a free warm line which offers peer-to-peer phone contact for individuals living with mental illness, addiction, or both. Coyote Task Force operates Our Place Clubhouse, which will continue to provide programs to help non-Title 19 SMI members re-enter the work community through pre-vocational and vocational rehabilitation services. Another exciting byproduct to emerge during this challenging period has been the formation of the statewide Consumer and Family Coalition. This group, a collection of peer and family member advocates with experience in navigating both the adult and children's systems, has been meeting regularly with leadership at the department for the last several months and has greatly increased the role of peers and family members in decision-making activities within our system.
We also are part of the Arizona Peer and Family Coalition. With the coalition, we are from all throughout Arizona, and we work together to identify the issues that are most important to peer and family members. and figure out ways to turn around and advocate for all of us to meet the services that would be necessary for us to be successful. And we have actively been on committees with the Arizona Department of Behavioral Health Services and even at the REBA level so that we can speak on behalf of whatever the needs are and try to figure out in this really tough time what we can do to get the very best we can out of the limited dollars we have available to serve the populations.
I am a part of the statewide coalition for peer support and family here in Maricopa County. We offer assistance to other REBAs and peer runs. What we do is we entice them to join our group to be able to assist in getting people better services and for the peer runs to be involved. We also assist in helping the REBAs understand what Title 19, what the non-Title 19 members are experiencing, how we can help them, how we can organize and get them to receive services from other faith-based charities here in the state of Arizona.
Even though this is a difficult time, we must continue to look ahead and move forward to do the best we can. The department, together with the REBAs and community providers, will continue to closely monitor transition activities and the health and stability of our system. However, we know that many challenges lie ahead. If the economy remains stagnant, more budget reductions are possible. As national health care reform begins to take shape, we must ask, what will this mean for Arizona? Other innovative healthcare delivery models are currently underway. For example, the movement toward increased integration with our community health center partners, a greater focus on prevention services, holistic health and wellness, and parity for behavioral health services, coverage like we've never had before. We remain committed to transparency, accountability, and member choice. For the first time ever, our REBAs now have provider-level performance dashboards posted on their websites. Members can now use this ongoing and real-time information to make more informed choices about their care. All of our REBAs have established their own Office of Individual and Family Affairs now as well, bringing the consumer and family voice into their organizations. Clinic councils comprised of individuals who actually receive services at that clinic are popping up all over the state, guiding improvements and the recovery-focused environment at the direct care level. I am so pleased to see the voice of peers, family members, advocates, and all stakeholders getting stronger every day and more unified than ever before. While our vision at the department remains the same, our approach has changed, and I hope you've seen this positive shift in transparency, accountability, and member and family involvement. We welcome you to join us as we face future challenges and opportunities in Arizona's behavioral health system. While our system has definitely changed as a result of the state fiscal situation, we must deal with these changes together and use them as an opportunity to create a better tomorrow for our community. Thank you very much.